Welcome to Work Comp Talk, a podcast dedicated to all of the injured workers here in the state of California. My name is Carmen, your host for today's episode, and joining me, I have Bilal Qasim, managing attorney and co-founder of Pacific Workers, the Lawyers for Injured Workers, which also happen to be the podcast sponsors. If you want to check out some of their wins, some of the stuff they do, check them out at pacificworkers.com. If you're new here, hit that subscribe button. If you've been here for a minute and you haven't hit the subscribe button, hit the subscribe button, hit the bell notification so you guys can get notified every time we dump new content into this podcast. New year, fresh and start. Let's talk about some of the positives and let's continue that trend. If you have yet not listened to the last episode, there's a lot of great information that was shared for those that have recently been injured and some of the changes that happened into the law or came into effect as of 2024 regarding workers' comp. So with that positive trend, we wanted to give 5 tips that are going to help you settle or work your workers' comp case to its best in 2024. And for that, we're going to pick your brain, Bilal. Are you ready for that?
Let's do it.
All right. Tell me the number one tip that you can tell anyone who's been injured, recently injured, that they just have to know.
Don't get hurt.
Well, duh.
Beyond that, I think one of the biggest trends that I've seen in workers' compensation over the last few years, and this year is no different, I think, so far, has been cases getting denied because there are factual disputes about whether or not the injured worker was hurt in the way they said they were, or whether they reported their injury. A lot of times people will tell their boss, hey, I got hurt on the job site. Boss will say, okay, don't worry about it. Take the day off and we'll figure it out later. And then when they can't figure it out later and they need medical care and they want to file the case, the boss denies ever having heard of the injury.
Oh, he didn't get hurt at work.
Yeah.
That didn't happen here.
Exactly. And then when you trust in that person, when you don't document the fact that you're injured, and then you're going back later down the road to try and prove that you reported your injury on time, that you told your boss, that you told your supervisor, whoever it was, and you don't have anything in writing to support that, it can be problematic because it's their word against yours in court. And so you want to do the best thing possible when you're reporting an injury, and that's documenting the fact that you reported it. So I think my biggest tip is probably to fill out a DWC-1 claim form, which is the official form that's used to report a work comp injury. And also make sure you document your injury in writing. So if you're going to tell your boss, don't just tell them verbally. Make sure you send them an email or send them a text message explaining that you got hurt, where you got hurt, and that you're going to the hospital or that you need medical attention.
Speaking about the hospital and medical attention, what happens when you don't properly fill this form or you don't find it or your boss doesn't give it to you? Where can they locate the DWC-1 form?
If you Google DWC-1 claim form, it'll pop up as the first search result from the state's website, the Department of Industrial Relations. And it's a simple one-page form, and it's really easy to fill out. There's one section that's for the employee and one section from the employer. And you can fill out the employee section and give it to your employer, or you can, well, if they don't have one or don't want to give it to you or don't want to give you the insurance, you can actually search the insurance on the WCIRB, which is a website for searching insurance coverage for California workers' comp, and you can send it directly to the insurance carrier for the employer.
Okay, and those links are going to be for you in the description. We'll also link it to the website where you're able to download this form. Again, I'm just thinking about the person that is working in a small moms and pops shop or in a place where they don't have an HR department. Things can get lost when you work in certain businesses, like to get a form, but it's as easy as going online. So we will help you locate that and also put it on for you on the description.
And I want to tell you too, if you can't fill out the claim form,
right,
it's sufficient to just tell your employer that you have an injury.
Why'd I just think it's sufficient to you for just lick it. Your DNA's on it.
Legally, it triggers the employer's obligation to report the case, even if you haven't filled out the claim form. And I know a lot of people sometimes are like, well, what if I'm unconscious? Or what if I'm so badly injured I can't complete the claim form? Or what if I have to go straight to the hospital? What happens then? It's okay. As long as you document the fact that you had the injury, that's good enough. The DWC-1 claim form obligates the insurance company to start their investigation. That's the legal requirement for them to do anything, but it doesn't impact your employer's responsibility to investigate and report the case if they know or should have knowledge, even from some other source, a third party perhaps, that you had an injury.
Right.
So don't worry if your employer is being a huge pain in the ass or doesn't know what it is or you can't find it or can't fill it out. You're still in good shape as long as, again, document in writing.
Now, what happens if the total opposite goes by? Let's say your employer does fill out the form and you do one as well. Because you give the form to your employee, they're just going to rip yours up because they already did one for you.
Well, both the employee and the employer are supposed to fill out the claim form. And so it's a two-part thing.
Gotcha.
So you can't have an employer just submit a claim form on your behalf without you filling in anything because it's on you to document the injury you had, the body parts affected, things like that.
Now, what if I'm going to take it to the extreme. You give an example that you went straight to the hospital, you were knocked out conscious. What if it just so happens that you're out for days and you don't fill your part out? Does a family member get to do that for you, or is that just your employer and then things move along?
Yeah, again, knowledge from any source that you had an injury is sufficient to trigger the employer's obligation to report the case and get the claim process started. So if, for example, you're in a coma, which has happened to a lot of clients, I've had a couple clients that were in a coma for over a month, they can't report the injury, clearly. But any reasonable person would agree that the fact that the client didn't go to work, that the client's significant other called in and told the employer, you know, my husband or my wife is unconscious in the hospital because they're hurt at work, or coworkers saw the person get hurt and told the employer, that's all sufficient so that the employee does not have to worry about filling out that claim form. That should be enough to get the claim going.
Okay, so that's your number one top tip. Like, one, don't get injured. Two, obviously, if you are going to get injured, document it. It's very important to have in proof, preferably in writing, whether that's a text, but it's something that you can essentially hold someone accountable as opposed to just having that conversation and, you know, it's your word versus their word.
Yep.
What's tip number 2?
Tip number 2, I would say, is in a similar vein, and that is make sure you keep notes about where your injury happened, the body parts affected, the people that were there that were possibly witnesses to your injury, and who you reported your injury to. Because, again, it comes back to credibility in a lot of these situations. If you're all alone on a job site and you injure yourself and there's no one else there, and you have a really crappy employer and they want to mess with your personal life, they're going to go tell the insurance that you weren't actually injured at work, that you told them you got injured at home, that you were helping your friend move, or that you were working on a side project and that's how you hurt yourself.
That's horrible.
And we see that happen all the time because the employer doesn't want to have their insurance premiums go up because you got injured, so they lie to the insurance companies to try and cover up the case. And when you report the case, guess who the insurance adjuster calls to verify whether or not you're injured at work? The employer. And so if you have a really shady employer, you can be in a predicament where you might not have a good result in your workers' comp case or a result at all if they lie. And if you don't have documentation to support the fact you're injured, it can be a nightmare for you in court to try and prove your injury.
Right.
So again, you know, it's not just about reporting the work injury, it's also about having documentation or evidence or witnesses to support your case, just in case the insurance company ends up denying your case.
Because it does happen. I've seen the PG&E folks climb up poles. There's no one near them. It's just them in their little truck. You know, sometimes they're in rural areas where there's no one there but birds and cows.
Yeah.
Damn, I can imagine how it must go for them.
Yeah, and I mean, look, sometimes it's obvious. If you're a lineman, like I think you're talking about, and you fall from a 30-foot power pole, chances are someone's going to see you lying there and call the ambulance, and no one's going to dispute that you fell from the pole. There's no other way that happens, right? But, like, I think we see it a lot with construction workers. I've seen it happen with movers, delivery drivers, where, you know, they'll say they got injured at work, and then somehow, somewhere, the employer comes out and says, oh, well, they were working on a side project. They told me they were helping their friend move or something like that. And we see it all too often. It's really shady practice, and the employee trusts their employer. They say, oh, well, you know, I got injured at work. The employer tells them, oh, we'll take care of you. We'll make sure you get benefits. You know, go to your own doctor for a little bit, see if you get better. You know, we'll take care of your bills and everything. And then they're lying through their teeth to the employee, and the employee believes them because they have that confidence, like, oh, my employer's got my back. They care about me. You know, they want to see me get better. They want to help me. And a lot of times that couldn't be farther from the truth.
Yeah, that sucks. Well, okay, that's a great tip then. Make sure you document everything, that you have witnesses if you can. Make sure you get their names. If it's a coworker, that someone has your back. What would be tip number 3?
Tip number 3 is just a good practice in general. some people get injured and they don't think an injury is that bad, and they decline medical care.
I could totally see that. Like, I'm good. I'll shake it off.
You know, I had a fishbone stuck in my throat recently. My wife was cooking fish, and the fishbone got stuck in my throat, and it was like someone was stabbing a needle in the back of my throat every time I swallowed. It was incredibly painful, and so I had to go to the ER. And I sat in the ER before going into surgery for probably almost 10 hours waiting at the hospital. And that whole entire time, I was like, I do not want to be here. And so the point I'm trying to make is there's a lot of people who hate going to the hospital because of that experience. I don't want to sit in a hospital for 8 to 10 hours. You know, I don't want to be there. And so maybe if I was injured, I want to see if I'll get better.
Yeah.
I want to try and go home and ice
Rub
my back,
some Bengay,
whatever, take
ice
some Tylenol,
it.
you know, try and get better on my own and see if things go away. And that's understandable. But even if you don't think you're that bad, or maybe you're not having that significant of symptoms, you should always go to the doctor and get checked out. So whenever you have an injury, my tip number 3 is go get checked out by the doctor. Even if you're maybe having questionable symptoms or you don't think you're that bad, it's always better to be safe. It's always better to go get that record that you were at the doctor, that you had an injury, and that you were seeking medical care. Again, the issue is if you get hurt and your boss offers to send you to their occupational clinic and you deny that, and then 2 months down the road when things get really bad and you actually need help, well, guess what? It's been 2 months since you reported your injury. You declined medical care, and now all of a sudden you want to see the doctor. Insurance adjuster's not going to believe you. Boss is not going to believe you. Doctors may find that questionable because when the doctor sees you 2 months down the road, they're going to say, well, you had this injury 2 months ago. You didn't seek medical care, and now all of a sudden you need medical care. Maybe we don't believe that you got injured this way. Maybe you had some other injury in between now and then, and that's why you're here. So it can cause problems for your case.
Not good. Not good. So make sure you accept the medical care that is being offered. Tip number 4.
This one's a little tough to explain, I think, but I think my tip number 4 would be to pick a good doctor that knows how to navigate the workers' comp system. And I'm not just talking about a doctor that knows medicine or surgery. I'm talking about a doctor that knows the system, because it's not like a normal doctor that just does whatever they want and bills your insurance. They have to request authorization. They have to know treatment guidelines. They know how to bill properly. They know how to write the correct reports in the right way to trigger an insurance adjuster's responsibility to do certain things. And if you go to a doctor and they don't know what they're doing in the system, that can impact your ability to get the treatment you need.
So how do you check and see if your doctor is one of the good workers' comp doctors? Do you sit there and like, hey, doctor, so how many years have you been doing workers' comp for? I mean, that's a great question to ask the doctor, right?
Yeah, I mean, you can ask the doctor about, how much workers' comp they do versus how much, private insurance they deal with, how much out of pocket versus workers' comp. You can ask them generally, the type of, cases they typically see, or you can generally tell based on the size of their practice. If there's a giant practice, right, let's say it's 20 doctors and they're 99% workers' comp, chances are they know what they're doing and they have a great system in place and they're able to do things the right way. If you go to, maybe a newer doctor that doesn't have really much, if any, experience in workers' comp, and they mostly treat patients with private insurance and they don't see workers' comp very often, they might not know how to do the right things.
Makes sense.
And it's not necessarily just small offices, big offices. I know plenty of doctors, chiropractors, PM&R doctors, pain medicine doctors, orthos even, that they're, one doctor shop, just them and like an assistant, and they're amazing.
That's true.
But again, it's just how much workers' comp do they do? How familiar are with the system?
Right.
And unfortunately, that's kind of hard to tell if you've never been in the system. At our law firm, for example, it's what we do. We know everyone, so we can tell who knows what they're doing and who doesn't. But nonetheless, it's an important component. And I think it's a tip to the extent you can find out and you can make that judgment call. It's in your best interests.
Yeah. And obviously, sometimes you get sent to these occupational clinics, and it's important to know that you're going to get stuck there for a minute, but you have the right to change doctors and you have the right to make those questions. So it's really good that we shared this one. I think so far this is my favorite one. Tip number 5, last but not least.
In workers' comp, when you have a denied case or there's a medical dispute, go to doctors called qualified medical evaluators. And they are, for all intents and purposes, the ones that control your case. And I would say probably the last and equally important tip is to make sure you end up with the right panel specialty and the right evaluator, because they can make or break your case. They really are everything.
Okay, so that's important. Pay attention to your QME. When you're getting assigned a qualified medical evaluator, do you have an option to choose?
It depends if you're represented or not. If you're unrepresented, you choose. If you're represented, you go through a striking process where each side gets rid of the doctor they don't like, and the doctor that nobody got rid of serves as your QME. But I think part of it's understanding who the doctors actually are, who the evaluators are. So there's a lot of times where clients have come to me because they've got a QME panel on their own. They went to an evaluation, and it's the worst possible evaluator they could have chosen because they don't know the system.
Right.
And so telling you to choose the right QME and the right specialty can be very difficult as someone who's going through the system for the first time. But my tips to kind of help figure that out are doctors have profiles online. You know, WebMD, I think, My Vitals, I think, is one. Google, Yelp, you know.
There's a new one called ZocDoc.
ZocDoc, you know. There's a ton of these like public interest websites where people are documenting their experiences.
LinkedIn.
Yeah, and it's not just about workers' comp. You know, they could have an experience with their private insurance or as a cash customer. And if a doctor has a profile and there's 50 people on there telling you this doctor has the worst bedside manner possible, they didn't listen to me, they didn't care, they were rude to me, whatever the case may be, it doesn't matter if you're a private insurance patient or workers' comp patient, your experience is probably going to be the same. And so you can Google the doctor's name and you can look up, you know, reviews and just get a sense of like where this person's at, you know, what their interests are. Are they really a patient advocate? Do people seem to like them or not? Beyond that, it is very difficult.
Yeah.
It is very difficult. You can look up QMEs to see if they have any history of discipline, which is always nice. But beyond that, I think for a lot of people that don't have lawyers, it's kind of a crapshoot.
Damn.
Because there may be some doctors that are well regarded as a medical professional, but aren't necessarily injured worker oriented. They're not there to go to bat for you.
Yeah.
And so I think, you know, kind of a last tip that's not really a tip, it's just good practice, is, you know, hire a lawyer to the extent you can, because, you know, we know the doctors, we know the system, we can make sure that you are picking the right treating physician, that you are getting to the right QME, and that the insurance company is not screwing around. So, you know, I think that's just something everyone should do. But
dude, I thought that was going to be your tip number one. Hire a lawyer. Tip number two, hire a lawyer. Tip number three.
It's a plug for ourselves. You know, I think everyone benefits from an employer. And I think on this podcast in particular, we talked about prior cases and issues that have come up where we flipped the script for the client and got them a fantastic result when they were getting screwed.
Yeah.
And even then, you know, there's a lot of cases where someone hires a lawyer and they don't get a great result, and that's just the system at play. And so lawyers really help navigate as much as possible and can help make these decisions where you don't have that personal knowledge or experience to act in your own best judgment.
Yeah. I mean, it happened to my dad. You know, he did have an accident at work where he, you know, cut his hand severely. And by the time he went to the occupational clinic and then decided, like, yeah, he needs to actually go into surgery and he needs to get taken to the hospital. And by the time they chose the hospital that he was going to go to, which ended up being Stanford, more than 24 hours had passed. And unfortunately, his cut was so severe, cut his tendons shrunk. So when it was time to, like, I guess, go in and clean up the mess, his hand was already healing. So he was already having scar tissue. And he lost a good percentage of his skin and his hand and his mobility. He's not able to stretch his hand out or use his hand as much. He lost the power to his hand. And that was all within the first 24 hours. Obviously, he was clueless, had no idea what the system was, how it works. He was in severe pain. I was young. I had no idea. My mom had no idea. So it's kind of like, shit, dude. Had we known, he probably wouldn't be in that situation. Maybe he would have he didn't even get a settlement. And his hand now is like this, dude. Like, what is he going to do? He can't even hold the remote.
Time is of the essence in workers' comp. And a lot of times you don't have the luxury to sit there and Google search information for 3 or 4 weeks at a time before making a decision. You have to act quick.
Yeah.
So,
and you don't even know what you're getting yourself into, because it's like not... Who's going to sit there and go through workers' comp stuff thinking, I'm going to get injured tomorrow? We don't. We just don't. So It's good that we have this podcast. If you just so happen to stumble on it, please let someone know. These amazing tips are going to definitely help you in this year to move your case forward, to know exactly what you should be looking at when you do come across the unfortunate situation of getting injured at work or knowing that someone got injured at work. So if anything, take these tips and try to navigate it. But the most important part is making sure that you have the knowledge behind what you're doing or having someone behind your back that is going to support you. So anything else you want to share? I know I said 5 tips and you gave that extra one. I'm pretty sure we can be here all day.
You know how it goes. I could go on all day about this stuff. It's what we're passionate about. It's what I know. It's what I've been doing for the past decade of my life, helping people, get hurt at work. And like you said, I don't care if you don't hire a firm. Just take what I say and please listen to me. And I hope you do what you can with this knowledge to get the best result possible and make sure you take care of yourself and your family. So at the end of the day, I just like sharing this information because I want to make sure it's out there for people to absorb so that they can, get what they're entitled to.
Agreed. Thank you so much for tuning in to another episode. We'll catch you guys on the next Work Comp Talk episode. Peace.